welcome to Practice Underwater. Today we have a guest that I am familiar with, but maybe not everyone in our audience is. Well, I would just imagine no one in our audience is. This is our real doc fake name, Elizabeth. So, Elizabeth, welcome to Practice Underwater.
Thank you. Thanks for having me.
All right. So I'm familiar with Elizabeth because she is a regular participator of our mastermind program that I run. So we have we call it the Ask George Mastermind. And so I want to maybe take a minute here and kind of get up to speed and acquainted with Elizabeth's story for the rest of you guys in our audience. And so, Elizabeth, maybe if you want to take our audience through a little bit of a backstory of you and your career, how you got to where you are today, that might be a helpful introduction for them as they can begin to get to know you.
Yeah, sure. I am a general dentist in the Midwest. I graduated in 2019, and then I was an associate for 6 years at the same place before purchasing a practice, which I did a little less than 8 months ago in a similar area. The practice is 6 ops. We have 11 hygiene days, and I'm the only doc right now, but looking for an associate in the near future.
Amazing. Okay.
Yeah.
I guess maybe walk me through like the practice that you purchased, how you
Mhm.
got the deal,
Mhm.
for our pre-owners who are listening, maybe kind of give them a little scoop into how you got into ownership.
Yeah, sure. I was on maternity leave with my second kid when I decided it was some good downtime to hunt for a practice. Went through a couple brokers and toured a couple offices that just didn't seem like a great fit or had been on the market for a long time and had some, less than desirable numbers. When eventually a broker brought this one to my attention, it was a private practice, kind of an interesting situation with the seller, but it was a private practice, PPO practice, and the numbers looked good. So went and pursued it. And it took maybe, I started looking in October and we purchased in July. So,
Okay. And then that was, coming up on a year ago now. So you're like 9 months in.
well, 8 months. Yeah.
Maybe describe what about this practice was appealing to you. So why'd you pick this one?
Yeah. So it's in a great location. It's a suburb just outside of a major city in the Midwest. It's a great patient base. The team had been there for a very long time. Most of them were long term members, good retention, and the numbers were good. And it looked like there was good work to do in the practice with chart audit and exploration, due diligence.
Yeah. And so maybe walk me through what happened early in ownership, right? So I'm familiar with the story, but kind of maybe get our audience more familiar. So you came into ownership and, you experienced some growth right away. So maybe talk through that process and what early ownership was like.
Yeah, early ownership was good. I had an associate doc with me for a little bit as he kind of transitioned out. And then I became the only doc. When I bought the practice, it was projected to do 1.2 that year. We finished up just a little over 1.4. So we had a little growth at the beginning, but it's still early on. We're early in this game. So just looking for some stability. We retained most of the team members at the initial transition, had to do a little bit of restructuring, but mainly the team stayed the same and the patients really love that. They have people there that have been there for more than a decade. So I think that's really helps the patients be more comfortable and more accepting of me being there for sure.
Yeah. And then, historically, you kind of talked about it like this, $1.2 million pace. Is that kind of the historical collections production, of the practice?
So it was getting to that place. It was stagnant at a long time at around 900, I think. And then an owner took it over for a short amount of time and he boosted it a little bit with his productivity.
Okay. And then where is your monthly collections at kind of roughly in last 3 months or so?
In general, we're around 120,000 collections.
Okay, so you've had some nice growth. And so it's kind of interesting. So like maybe I'll tell the story of a mastermind call we were on. You came on the call and you asked about marketing.
Yeah.
And you're laughing because of what happened. Yeah.
Yeah,
It was
'cause
one of those, sometimes when you're in a group environment, the group like kind of gangs up on an idea that like and it wasn't like anything personal, but it was just like it was just an aha moment for a lot of people. And so I
yeah,
think, so in your situation, you have a patient base of 3,000
yeah.
and you
So
have a 6 operatory practice.
mhm.
and you have 11 hygiene days at the moment. So maybe walk us through the hygiene schedule. It seems like you work 4 days a week, and there's three hygienists for 3 of those days, and then there's, on one day, two hygienists. Is that correct?
Yeah, that's right. Yep, we're Monday through Thursday.
Yeah, so Monday through Thursday. And which day of the week is the one with two hygienists?
Monday.
Yeah, Monday's always a great day for that because you get a lot of emergencies, and it's like it's
Mhm.
kind of nice to have the extra operatories. So do you produce out of three operatories or two?
We produce out of 2, and then we have an overflow for emergencies, same days.
So your six operatories is two of production, three of hygiene on most days except Monday, and then you have an overflow for emergencies and whatever comes in that day.
Yeah.
Perfect. So I guess now, like, I understand that there's, some conversation around, like maybe let's talk about the building,
Okay.
because that's going to be kind of a bit of a topic of conversation during this episode. So maybe so that's like why are we recording this episode? Is to kind of noodle through this kind of building situation that you're in. So maybe kind of introduce this situation to our audience and the different options and what you would like to explore, and then I'll kind of tailor the conversation a little bit here or there.
Yeah, sure. So, with bringing on an associate, I was initially thinking we'd add 2 ops to the existing space, which would be tight, but we have the room to do it without knocking down any walls. So, the construction isn't too heavy. But the current space isn't my favorite. It's a very dated space, it's a dated building, and it doesn't have an elevator, and we're on the second floor. So, no plans to put in an elevator. That's really not an option. The stairs are metal with open risers. So, my patient base is older, and lots of them just have a lot of trouble with it and say things like, I don't know how long I can keep coming here just because of the accessibility. So, that's been an issue. No signage, just not my favorite location, but didn't want to pass it up because it was, the practice itself was thriving. So my goal was to add 2 ops, and then when our lease is up in about 2.5 years, think about relocating, or if the market wasn't looking great for that, staying on for another 3 years and going from there. I have several 3-year options. But then my realtor came to me recently and told me that there's a building for sale very close to my office, and it's a very attractive building with lots of perks. So that was why I wanted to chat today to explore that option.
Yeah, so maybe walk me through the building that's
Yeah.
available.
Yeah, so it's really nice. It's only a half mile from my office. You can practically see it from my office. All the patients know it on the area. It's on the same street, just directly down the street. It has great visibility, signage, it's one level. And then the big perk is the space that I would be occupying was a dental office at one point. It was plumbed for 6 ops. There's a wellness clinic that's in there now, but they didn't take down any walls. They just capped the plumbing. So it's essentially ready to revert back to a dental office. And then there's other tenants in the building as well.
So what I'm hearing you say, which is kind of like the maybe the thing that we want to touch on the most, is that you are not, this is six hops, right?
Yes.
So, I guess maybe walk me through, because like you want more, right?
Right.
So
Right.
maybe walk me through that part of this opportunity. Is there an ability to add operatories in the future? It doesn't seem like
Sure.
either tenant on either side is really moving.
Yeah. That's why I'm doing mental gymnastics and trying to figure out if some awkwardness for the next couple of years makes sense for the long run. But there is a space next door. I'm not sure if they're, maybe looking to get out sooner than their lease was planned. But if they aren't, they're there until mid 2029 with one option for 1 year. So at the latest, they'd be out mid 2030. So that would leave us in an awkward position
Yeah.
for about a year and a half.
So now let's talk about your vision and why you want that. So I guess you kind of, I guess for everyone listening in our audience, like the idea of an associate kind of came out of your mouth somewhat quickly. And
Yeah.
so, like, I think that, like, maybe to back up and say, like, what is your vision and why would be maybe an interesting place to go. So, like, maybe talk me through what is your vision, where you want to go, and, kind of what's the best way, and then we'll talk about the best way of getting there. But first, I want to make sure I understand your vision and why you want that vision.
Yeah, sure. That's a good question. When I first joined the share practices coaching. That was my biggest question, was trying to figure out what my vision was. It was pretty early on in ownership, and there were a lot of moving parts. But basically, it came down to we have this larger patient base. We're booking out really far, booking out too far in restorative. You said on a mastermind call once that if you're booking out too far, you're not competing with other dentists, you're competing with, vacation, and people can talk themselves out of treatment. So working out too far. So the option was kind of, do we cut insurance, try to go fee for service in a way, or do we add an associate and take advantage of the patient base that, we purchased in this acquisition? And ultimately, I just didn't want to lose kind of what we purchased in the acquisition. And then also, I have a family and I would like to have an associate in a way that it would allow me some flexibility for, making school pickups and things like that, having my hours be a little bit better as we alternate the schedule.
Yeah. So now I think that it's my job to really push you in different areas.
Yeah.
So, like, for example, let me just say this option, right? You have 3,000 patients.
Mhm.
So, like, very clearly, you have more patients than you have capacity for. So, what if I were to say you had the ability to condense your schedule to, like, what would be ideal hours for you?
So I would say a goal is that when my kid gets in school, which is, maybe 3, 4 years out, I'm fine with working early, but I'd like to be up by 2:30, but I'm okay working more days a week to accomplish that.
Yeah, so like a Monday through Friday. Do you take to school in the morning, or do you anticipate taking to school in the morning as well?
I do right now, but I don't need to.
Okay, so you can have your husband do that, is
Mhm.
what you're getting at.
Yep.
So then you could potentially run like a 7 to 3 no lunch type thing, or is that not something you're open to?
Yeah, we could do that.
I think to assess the critical requirements is like you have the option to have a simple fee for service practice
Yeah.
because you have the option to, like a simple fee for service practice would increase your margins and also make things significantly more profitable for you. And then you could potentially work less, have a simpler life, and, also kind of like take vacation or whatever. And you just, you work 3 weeks that month or whatever it might be. So you could like, you could potentially move into the space with 6 ops, keep doing what you're doing, cut your low performing insurances, increase your, bring your patients in, retain them, increase your fees, increase your revenue, increase your profit, and not go to a multi doctor situation. So the reason I'm exploring this is because for us to kind of like say, okay, this is your vision, this is what you want to do, we need to be convicted in that. And I want to ask some mental gymnastics types questions to increase your conviction in your direction. Either change your direction into one that you feel very convicted in, or proceed with what you think you want, but more clear on why you want it. So, what are
Yeah.
your thoughts on this fee for service, simple practice, keeping it solo long term? This space would be ideal for you. What are your thoughts on that?
Yeah, this is a conversation I had with Lori, my coach, so many times. It has tormented me throughout the beginning of ownership because I just think there's so many pros and cons.
Yeah. So, let's talk through them.
I think having an associate there is nice to have a wider range of what we offer. I'm not big into surgery. It'd be nice to have someone there to do some of our surgeries. I like the idea of if there's something going on at school, like say a school play, I could maybe pop out for an hour and come back and have it not be a big deal, someone to bounce things off of. But I'm coming from being an associate. I know most people don't want to do that forever, want to go into ownership. There's going to be turnover. I have to really look for the right person. So that brings more unknown in, more complicating factors. Increasing the team size also does that as well. Those are some cons of going with the associate. I don't know, I kind of see it allowing for more flexibility to get to more school functions with the kids because at the end of the day, that is my priority. But I don't know if that's a falsehood, that it is more flexible.
Well, I think that pick your problems is always
Mhm,
one of my favorite frameworks to assess a decision like this. Let's consider a bad case scenario in both options.
mhm,
So, one common sort of it's when group practice is not done well, people report that like they have a more complex staff, they have more complex schedule, they have a more complex operation, and they don't make more money. They're making like so I would think that income wise, I
Mhm.
think you're looking at potentially quite a similar situation as if you were to like increase fees and kind of go to, what I would, and hate the terminology, but like maybe the mom schedule, right? Like
Yeah.
that's like, kind of like increase fees and constrict your schedule to be very accommodating to school
Yeah.
and to be there for your kids in the way that you want to be. I could think that you could make the same amount of money doing that and have the off time where there's a play. You block it out on your schedule. I'm not available for production. And then, those hygiene patients, you're just going to have to check virtually, right?
Yeah.
And like it's all the flexibility. I think I want to push you on the fact that the flexibility could potentially be there. But then at the same time, with the group practice, you say, okay, like I have more flexibility, easier flexibility for sure, right? Like the flexibility in the group practice environment is definitely there. Like you can leave, the other person can cover. You can, if your kid is sick, you can like pass your patients off for the day. Like there's a way more flexibility that will come.
Right.
But it also comes to the point of your income. You might imagine your top line being twice as much and your income being the same in both configurations, right? So it's like you
Mhm.
could be doing, or maybe it's like you're doing, 140 as a solo and you're doing like 200 as a group practice and you're making roughly the same, right? So
Okay.
you're managing a larger, more complex operation and you have the same income. So like if I kind of throw those two ideas out there, what resonates to you? Like what do you grab onto, good or bad, on either side?
My biggest concern with going to group is getting calls evenings and weekends from increased team members being increased operations, having more problems naturally coming along with it would be my bigger concern there. Are you worried that my patients right now, at least as I've kind of acquired them, are seem very insurance driven?
Yeah.
So I am worried how many we lose as we drop insurances. And then factoring, potentially relocating, haven't won them all over yet.
Yeah.
Are we gonna relocate and then or even without relocating, just dropping insurances. I'm just worried when we look at referring to specialists, my patients are very much who's in network, only wanna go there. So that makes me a little nervous.
Yeah. So I think let's go through those individually. So the office manager is going to be a huge piece of the group practice, right? So if you have an associate, you're going to have an office manager. And if you have them trained properly and have them
Mhm,
empowered properly, then a lot of that day to day staff, HR, like
mhm,
that
yep,
pain point should be delegated.
okay,
And I say that should because that doesn't most I would say most don't do that effectively. But it's definitely enough people have done that effectively to know that it's something that can be done repeatedly. So that one, like, we can handle that way. The second point's a good point, and I want to kind of maybe throw a different counter argument to you. So you currently have 11 days of hygiene,
mhm,
which means that you have the proper capacity to see 2,200 recare patients in your pool. You
mhm,
have 3,000.
mhm,
So, technically speaking, you can afford a cut of a quite a large size and not have it would actually your revenue would grow and you would lose a bunch of patients. So, like for example, if I kind of do that math, you can lose, 27% of your patient base, retain 73% of your patient base, and be higher revenue, more profit because your capacity in hygiene is such that you can see about 2,200 patients.
right,
So there's a real mathematical argument to be made for the fact that if you like, there's two different types of going fee for service. There's going fee for service with no explanation, no team preparation, no anything like that. And there's also like teach your team how to talk to patients about being out of network and also cut them one at a time,
mhm,
starting with the lower performers and keeping some of your better insurance plans, right? So it's like there's a transition there. Based on your situation, I actually think that going fee for service and maintaining your patient flow is operationally possible, but requires some intentional effort.
right. I did forget to mention that one of my driving factors that's become less of a driving factor now was that checking through hygiene isn't my favorite way to go about the day.
Ah,
I like to spend a little bit more quality time with the patients in a perfect world where I see ideal treatment and time spent with patients. I forgot that was a big driving factor at first. It's gotten better as I've done more of it, but
Yeah, so I think that's even another vote for the fee for service camp, right? Because you could cut your patient base like
and
to
go
the
down
point.
there.
Yeah, exactly.
Okay. Interesting.
I'm trying to push you to think through both options and to find like what is the ideal path for me and like kind of get that. So I mean, like, as we've gone into this conversation, do you feel one path is more appealing than the other for whatever reason?
I still kind of lean group.
Good. Why?
I don't know. It seems more exciting to me.
Good. Talk about that. Let's see that. What's the excitement?
I've always liked working with another doc. I feel like it keeps you up to date on like doing CE and pushing yourself clinically. I do like the idea of having an office manager, having a bigger team. Yeah, I think it's just exciting.
Yeah, and there's more net worth. And so would you be good with a world where like let's just say, I mean, I'd imagine right now you're doing 120 a month, you're a solo practitioner. I
Mhm.
would imagine you have a healthy income for your, like I mean, I'm imagining your income is not a pain point. Is that correct?
I've been leaving it in the bank account. I just take a draw every month that we need for expenses and haven't
Yeah,
taken anything out for myself yet. So it hasn't been an issue.
good. So if I were to say that your income would remain the same and your practice would be twice as big and you would have
Mhm.
an office manager and twice as big of a team, which it wouldn't be quite twice as big, but it would be like maybe 40% larger or something.
Yeah.
How does that sound to you?
I'm okay with that. I will also add that we refer everything out right now, even procedures that I have done for the past 6 years just because of how much Crown& Bridge we have right now. So I would like to get back to doing more of that too, and
Yeah.
hopefully that will bump us up a little bit.
And then, maybe for my own sort of knowledge, now you brought up something interesting, which is the associate turnover piece. And so there's really two ways to go about this. One way is to sign up for the turnover and maintain autonomy and 100% ownership of your practice. The
Right.
other way is to try and get some type of minority partner track for somebody where they start as an associate and then eventually they become a partial partner. And then you have more stability. Have you thought about either of those options?
I have thought about it. I think it would really come down to what makes sense with the numbers. I think I'm okay with accepting turnover if it's not a crazy amount of turnover. I'm thinking of myself who was with the practice for, 6 years and I'd be okay with that, but are returning every year or 2? I don't love that for the kind of practice that I'm trying to run with the patients. So I would be okay with longer term turnover. I just don't know what the numbers look like with somebody buying in at a minority share. I don't know how much that affects. It's just not my area of expertise, I guess. I
Yeah.
can't even imagine what that looks like.
Yeah, and I think I would sign up for turnover once every 2 to 4 years when done well.
Yeah, okay.
So, when done well, once every 2 to 4 years, you're turning over the position. When
Mhm.
done poorly, less than 2 years. But I
Okay.
think that, like, candidly, to expect that you're gonna have 6-year docs for your whole career. So, if you're
Not
gonna work for
likely.
20 years and you're gonna have 4 associates over the course of
Yeah,
20 years, like, I think you should sign up for a little more than that if you're gonna
yeah,
choose that route.
that's fair, that's fair.
And then who knows, right? Maybe you start out with the associate route and then you get to the point where you're like, "You know what? I really like this person. I really want them to stay. I'm willing to go down the road of exploring what that could look like to keep them happy and to lock them in." Right? And you might have that and it's very malleable. From my perspective then, it seems like we're settling in on a group, which I think is kind of exactly where I wanted to go for this first part is to really explore the idea of a group practice and what that would take, which then brings us back to the real estate because
Yeah.
so then I mean what is the minimum number of operatories you would feel comfortable with two providers? I have my own answer, but I'm curious to hear yours.
So, this is where the mental gymnastics comes into play because, I mean, ideally, I like 8, 6. I came up with a schedule that I feel like 6 could happen. If we're talking about overlapping leases with the new real estate and we can use a couple of those ops down the road for maybe specialty days, then that opens up a little bit more room. I think 8 is ideal, but could maybe be uncomfortable on 6. I don't know. What's your number for that?
It's a simple equation on our side, which is 4 operatories per full-time dentist. So 2 full-time dentists means 8,
Mhm. Yep.
right? And then if you add one, you have an overflow. If you subtract 1, you're making a compromise. If you subtract 2, you're making more compromises.
Okay.
So I would say that I kind of tend to agree with your logic of 8 being a number to shoot for. And then I think that this then kind of gives us a preview into part 2, where we have this kind of difficult sort of situation where we have 6 operatories currently. Our current space is an old building that doesn't have a good accessibility for our older patient base. And we can add 2 operatories to get it to 8. However, there's an ideal built out dental place, which is right down the street, a half mile away, 6 operatories fully built out with the ability in 2 to 3 years to expand.
Yeah, ish. 2.5, 3.5, but yeah,
Yeah.
ish. Yeah, that's right. Yeah.
So I think that we noodle on that next episode. And we kind of see what do you think is, the best path, knowing that you're probably going to be making some trade-offs.
Yeah, that sounds good.
So before we close this episode, I'm curious, do you feel more settled in your vision at all throughout this conversation? Because that was kind of the goal of this episode in part 1.
Yeah, I feel like I was so uncertain at the beginning of ownership, and then I finally settled on group practice, and then you brought up some very good points today, but I am back to group practice. I feel good about it.
Well, and I think that it's important for you to identify that you're like, you know what? I like the idea of having an office manager in place. I
Mhm.
like the idea of having another dentist so I could have even more flexibility as a mother. And I'm good with some of the negative sides of the trade-off, right? Like, I think that's kind of where I kind of pencil you at is, I think that you're good with some of the negative things that, like, I think that sometimes for the owners out there who are all about how many days am I working and how much am I making, it can be hard for them at times to make the group practice trade-off because they're like, I manage more, my revenue's higher, I work one less day, and I make about the same as I did as a solo. And it's like, maybe I should have just kept it simple and made more and worked one more day. Right. And it's like, it doesn't seem like you would be the type of person that would be unhappy with that trade because I think you would appreciate the flexibility on an ongoing basis. Like, yeah, I come in, I work my hours. Like, honestly, if you had an associate in place, you could potentially get like, there's a lot of hygienists out there who want your same schedule, right? Like, you're a mother, you drop kids off at school potentially. I know you said you don't have to. You pick them up from school. There's many hygienists out there who want that same schedule for their kids, right?
Right.
So you could potentially have like you plus 2 hygienists that match your schedule with you, and then you kind of just like you settle into those, that school schedule in the office, and like I think that you're gonna love that if you can get to that point.
Yeah, I think so too.
Okay.
I feel good about that.
Good. So, do you see any areas where you could potentially become unsettled again, or do you feel like this conversation will have an everlasting, like, settling effect on you, where you're like, no, 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 I get it. Like, I've vetted it. I know what I'm doing, and I have more conviction in it.
I have more conviction in it. I feel good. Yeah.
Good.
Ready to move forward. Let's do it.
All right. So we're going to come back next week. Well, obviously for you and I, we're going to come back in 5 minutes,
Yeah.
and we're going to record part 2. But our audience will listen to that next week, and we're going to go through now that we've identified a path. We know we're going with the group practice. What are we going to do with the real estate? And I think that that's a very interesting situation. And I'll be honest, I think there's 3 choices. I think there's option 1, which is take the 2 operatories in the existing space and kind of you have the stairs and that type of thing, and you kind of compromise. I think option 2 is you go into this existing space that looks appealing, and you wait and be patient for when you can expand past that. And then option 3 is find the new space. Right. So I think that those are kind of the options on the menu. And we're going to take a look at those next episode and see which one makes the most sense for Elizabeth. So really appreciate you coming on today. Appreciate you sharing your story. And I feel like we got it to a good spot here in part 1. And I'm excited to kind of dive in part 2.
Sounds good. Thank you.
Resonate.